Have you ever felt like you're doing all the right things for your knee pain and it's just not helping? You've gone to the doctor and gotten pain medications, you've even gotten a cortisone injection, you've gone through several different braces, you've even tried exercise, and it's still just hurting a lot. Hi, I'm Dr. Eric Gullen, a physical therapist here at Village Fitness and Physical Therapy, where we are passionate about helping seniors just like you redefine age and reclaim their health. And when it comes to reclaiming health, sometimes we gotta reclaim those knees. They're in pain, they're limiting us from doing the things that we love to do, and I wanna share with you some powerful tips on how you can take more charge of your knees. In this video, you'll learn the 4 sides of the knee and the anatomy at each of those locations, how to assess it yourself and determine where your pain actually is, and then we'll match that with our favorite exercise that we use in the clinic for each of those different spots. So we're gonna start our self-assessment of the knee on the front side. We're gonna start up in the big muscles on the front side of your thigh. They're called the quadriceps. And we're not gonna worry too much about these muscles. What we are gonna start to worry about is the tendon right here, right above the knee joint. It's called your quadriceps tendon. And so what I want you to do is I want you to push, and you can do this with 2 hands, down that tendon and see if anything in there reproduces the pain that you've been struggling with. You can continue to move down to the point where you're just above the kneecap. It's called the patella, and you can say, is my pain here? It's not. You can keep moving to the front side of that patella and see, again, if your pain is here. And just keep moving on down. It's gonna feel a little squishy as you get to a new structure called the patellar tendon. And then finally, we're gonna end up on this little bony prominence that's called the tibial tuberosity. You don't have to remember that, but that's where our assessment of the front of the knee ends. So you just wanna know, is one of those areas where my knee hurt. Let's continue our self-assessment of the knee with the inside of the knee, or we call it the medial knee. And what we're gonna do is we're gonna first start with our adductor muscles. So we have the quadriceps up here. If we go to the inside, we have the adductors. And so we're gonna go to the end of kind of the muscular squishy part of those muscles. And as we palpate, you're gonna feel some bones right here, and that is your femur and your tibia. It's where they come together. It's what we call the joint line. So we're gonna start to press in here and see, is there any pain on the joint line? And as we palpate along the joint line, we're also gonna be palpating something called the medial meniscus, which you may have heard of, and we'll take note if there's pain there. And then we'll continue to move down. Remember when we assessed the front of the knee, we talked about the tibial tuberosity. So we're gonna be just an inch or so below that into this area. And this is called the pes anserine. It's where all of these muscles come over and attach to the tibia. And we're gonna see if our pain is right there. So typically inside knee pain, it's either gonna be on the joint line or it's gonna be a little bit lower down here on the pes anserine. So now we'll continue on to the outside of the knee. So once again, we'll find the big muscles over here and we'll start to follow them down until things get a little bit more tendinous, kind of ropey and more fibrous, less of that squishy, muscular, meaty part of the thigh. And right around here, so if this is the top of the patella and now we're about an inch outside of that, we're gonna find something called the iliotibial bursa, and that's a site of a lot of pain. If you feel like your pain is kind of on the top outside of your knee, a lot of times that's the iliotibial bursa. And then we'll continue to move down until we're splitting the patella. So again, here's my patella, so kind of right in the middle of that, and then an inch down or so is gonna be the lateral or the outside joint line where the femur and the tibia are coming together. So we'll see if we have any pain there, which is where the lateral collateral ligament is, or the LCL. And then we'll move down just a little bit further towards the foot, and we're gonna get to a bony prominence right here, and that's actually the head of the fibula. And sometimes outside knee pain is actually not the knee, it's this bone here, the fibula, on the tibia. So 2 bones coming together here, another little joint there. But if your pain is kind of right on that bony prominence or right around it, sometimes that's what's going on. All right, so we're finally gonna assess the back of the knee. And if you're doing this along with me, which you should, you can just put your knee in front of you like this and palpate along this way. But so that you guys can see, I'm gonna turn my leg a little bit. So Once again, we'll find the meaty part of the back of the thigh. In this case, that's the hamstring muscles. And we're gonna move down towards the knee until we get to these more fibrous, cable-like structures. And these are the tendons from our hamstrings. And so we're gonna test the one that's on the outside of the knee. We're gonna kind of push the one that's on the inside of the knee and see some of my pain there. If you go directly to the backside of the knee and you just poke kind of right into that space in there, in the in the elbow of the knee, you could almost call it. We're gonna see if there's pain there. And then we'll move down towards the lower leg. And once again, we'll go outside and we'll go inside, looking at the still the tendons of the hamstring and also the tendons of the gastrocnemius, or the calf muscle, and we'll see if one of those locations is where that familiar pain is. So now that we've assessed where the pain is, we're gonna teach some exercises that correlate to each of those areas. So we're gonna start with the front of the knee. And now the good news about these exercises is that regardless of exactly where that pain was on the front of your knee, this exercise is gonna hit all of those areas. Now, what we're gonna use is called a wall sit, and you probably remember doing these in gym class a million years ago, but it's an amazing isometric exercise. It means it's not moving, which makes it really, really safe for addressing a lot of different types of issues. Plus, because you're on a wall, you can dial in exactly how difficult is appropriate for you, making it easier by standing up more, making it harder by sitting down more. So for most of my patients, I'll start them just above parallel, meaning the point where the thigh is parallel with the ground. And I'll have them start with 3 sets of 30 seconds, done 3 times a week. So easy to remember. You'll feel within the first 10 seconds, these quadricep muscles start to burn a little bit. You'll start to feel a little bit of tension in all of those different structures on the front side of the knee. And what that's gonna do is it's gonna help start to induce a healing response in the body on the front side of the knee. Now, the body's healing system is incredible. It's so intelligent, and we don't give it enough credit for what it really does. And sometimes we overcomplicate things when all we need to do is put our body in a position to engage the tissues that we're struggling with safely and effectively, and we don't have to overthink too much. A really simple isometric exercise like this, and oof, I don't know if that was 30 seconds, but I was already feeling these muscles working, is really powerful for addressing every single one of those different kinds of pain that we talked about on the front side of the knee. So again, 3 sets of 30 seconds, 3 times a week. You can dial that into the difficulty that's appropriate for you, whether that's just a little teeny tiny knee bend like this, all the way down to a position just below parallel, trying to find that tension on the front side of the legs. Give it a try. All right, next up, let's talk about that inside knee pain. So we talked about pain at the joint line or the medial meniscus. We also talked about pain down here, the pes anserine bursa, and where all of these muscles attach down here. Now, both of those places are really well addressed by an exercise called the seated good morning. So what you do is you sit yourself down at the edge, which is really important, of a chair or a bench. And then you're gonna take your legs out wide with straight knees and feet flat. Now this is great because you can make it easier by bringing your feet in a little bit. You can make it harder by bringing your knees out more. You can also make it easier by using small range of motion at the trunk. You can make it harder by using a big range of motion. And what you want to do as you go through this exercise is you want to feel a stretch in these muscles here. You don't want it to reproduce pain here. So if you're feeling that, use one of those easier modifications I just showed you, either not moving as far at your trunk or not having your feet out as wide. But what it's going to do is it's going to start to use these muscles and tendons here. It's going to start to interact with all of those structures that have pain and inflammation, and it's going to help activate the body's innate healing system so that it can address inflammation, pain, stiffness, and weakness. So again, it just looks like this. And what I recommend for my patients is 30 repetitions, because they go by kind of fast, for 3 sets, 3 times a week. So easy to remember those 3s. Give it a try. So when it comes to outside knee pain, what causes a lot of it is a weakness of the glutes that cause some of these muscles on the outside of the hip to work too much. They cause a weird alignment and a friction of the iliotibial band and poor support of the joint line on the outside. So we can address this with a good old-fashioned hip clam. So what we're gonna do is lay on one side. We'll bend the knees, bend the hips a little bit, feet will be together, and we're simply going to lift one knee
away from the other without opening the pelvis. So really important here that it's just the femur moving on the pelvis, or the thigh moving on the pelvis, you could think of it, and not the whole thing coming back. So if your whole body's opening up, you got to keep it in a little bit tighter. In about 10 repetitions, you should already start to feel these muscles here working. I know I do. This is something that you can make harder simply by taking the heel up as you take the knee up. You could also potentially start to straighten the knee a little bit and kind of move like that. Sometimes ankle weights can even be useful. The point of all of these is just to isolate this area and really feel a nice muscle burn there. So any of those options that give you that are a great way to do this. As with the other exercises, I like to recommend 3 sets of 30 repetitions 3 times a week. So give that a try.
All right, so now if you've got pain on the back of your knees, the most common exercise that I recommend for this is called a top down. And what we're gonna do is we're gonna put a towel roll or maybe a book underneath the toes so that it lifts our toes up a little bit while our weight stays on our heels. We're going to push the hips back with straight knees and a lifted chest. And we're gonna start to drop down until you feel a stretch in the top of the calf and the bottom of the hamstring area. You might also just feel this directly behind your knees. As we talked about in the other exercises, our body is really clever, and a lot of times all we need to do to solve pain, inflammation, stiffness, and weakness is simply interact with that tissue in a meaningful and safe way. And so this exercise I'm showing you right now is a brilliant way to do that we've had a lot of success with in the clinic for the backside of the knee. So I want you to try that. 3 sets, 30 repetitions, 3 times a week. Use that rule of 3s just to keep it really simple in your memory. You can make it a little bit easier by just not going down as far. You can make it harder by going down further. You could even potentially shift some of that weight towards the toes to make it a little bit harder, but just make sure you keep that chest up and your knees straight. On behalf of Village Fitness and Physical Therapy, thanks so much for watching. Remember, our mission is to redefine age and reclaim health, and we hope that this helped you do that with your knees.